In transportation, we're about moving people. And I think it's a great shame that in all of these discussions, we sometimes lose sight of our customers. We will have a better industry when we have service for people and not programs. So the bus that's rolling down the road is the bus for everybody. It should be our job to provide the ride, fill the empty seats, create efficiencies because we're ride-sharing people together, and all the invoicing and cost-sharing should take place in the back office. The benefits to customers and funders are that people then will receive the benefits they're entitled to. If people stick on the ADA paratransit system and don't use their Medicaid benefit, they're paying fares for trips they probably can't afford. And the other benefit is that each sponsor then pays its fair share. We have a benefit in Pennsylvania in that we have a very strong foundation of coordination in our state. And in fact, it's required in Pennsylvania to be able to capture the state dollars. We also have a variety of state-funded transportation programs. We're very fortunate in that respect. But in Pennsylvania, each county is the recipient of those funds, so the design and implementation of transportation reflects the local conditions in each county. So at the local level, it's very powerful because you get to create a kind of system that works for you, but everybody's riding together and everybody's sharing the costs. Allegheny County is where Pittsburgh is, and in our county there are two recipients. The Transit Authority is the recipient of the transit dollars, and the County Department of Human Services is the recipient of the Medicaid dollars. This also turned out to be a very powerful relationship because the Department of Human Services has a human service orientation. And that's to a large extent what you need in a Medicaid program, because the job of that program is to make sure that people have access to the medical care that they need. That's not a transportation decision. That belongs more with an organization that has that kind of orientation. So our medical assistance transportation program is very person-centered, and the county considers transportation as an entry point to its entire human service transportation, or to its entire human service offerings. So the county wraps around people who are eligible for transportation and makes sure that they get linked into other services. The Department of Human Services in Allegheny County then manages the medical assistance transportation eligibility of people and trips, and they are the ones that make the decision about which mode of transportation their customer uses. Will they receive direct reimbursement for a car? Will they get a bus pass, or will they use paratransit? This relationship is very much built on cooperation and collaboration. And the partnership not only includes the institutions, but the customers themselves and their advocates and community-based service providers. It's absolutely essential that you have the cooperation of all these parties to make this work. There's an understanding in Pittsburgh that it is important that the transportation service be vibrant and effective. Nobody can get anywhere if the transit authority goes broke.